But maybe you can just start with this. What is regenerative medicine for people that are listening out there? We're in 159 countries now, but there's a lot of education that we have to really get out there so that people know their options when it comes to neuromusculoskeletal pain.
Yeah, I think a great place to start because there's a lot of confusion around that very term, regenerative medicine. So in theory, regenerative medicine is a discipline of medicine where we're working towards regenerating the body from the inside out. Okay. Now, interestingly enough, most of the practice of regenerative medicine today in its current form doesn't actually regenerate that much. So we're a little ahead of ourselves in terms of our goal, which is to regenerate the body, which we can do with some capacities, limited capacities. However, we're moving towards that ultimate end goal. What we're typically doing in regenerative medicine, and that involves a lot of different things. Today, we're going to focus on one element of that, which is cellular therapies, which is near and dear to your and my heart. But we use living cells to try to stimulate management of disease and wherever possible, stimulate healing. Okay, now again, there are limitations to what we can do to stimulate healing and regeneration, but that is the goal. And that is what the cells are trying to drive. That's the process they're trying to drive when we apply them in our cases to orthopedic issues and orthopedic conditions.
Yeah, well said. And also, having a look at my success rate with patients, like about 90%, but that doesn't mean all 90% are regenerating. It's functional. They're getting functional results. They're getting, at least 80% in their pain reduction, which is really, really success for me. But we do see those that do want to retest and rescan where we see regeneration, especially in the knee. We've seen that significantly, the meniscus regenerating. But then the typical MD around the corner, the orthopedic surgeon or the sports medicine doc says, listen, it's impossible to regenerate cartilage. What would you say to that with regard to, let's take the meniscus of the knee, because that is a common rebuttal that I get from patients and clients over there. Yeah, my doctor, my surgeon says you can't regenerate the cartilage.
Well, let's break it down a bit further. So the tissues that we deal with in orthopedic problems, degenerative processes, meniscus being one of them, have a common theme, and you know this, but for the audience, we'll reiterate. They're what we call avascular structures by and large, meaning they don't have a direct blood supply. Because they don't have a direct blood supply, their capacity for healing is ultimately limited. If you can't get blood to it, it can't really fix itself. Now, meniscus is an interesting one because the outside part of the meniscus does have a blood supply. The inside part of the meniscus where most tears occur does not. So that one's a little bit unique. But cartilage, discs in our spines, tendons, ligaments by and large. These are all avascular structures with limited capacity to heal. And that's why the effect of living and aging is cumulative. It builds up because the tissues can't revert themselves back to normal, like your skin can, for example. We accumulate degenerative processes, and so many of us then end up living the second half of our lives with painful degenerative orthopedic issues. So if we look at meniscus, we apply, the concept is, okay, well, if the tissue can't fix itself, in simplistic terms, then what's the reason for that? Well, blood can't get to it because it doesn't have blood supply. So in theory, just think about it, couldn't we take the elements of blood that contribute to healing and apply them where they can't go? In the meniscus, in the disc, in the joint, cartilage, etc. In theory, it just makes perfect sense. It's incredibly simple. Now, the processes that are stimulated are immensely complex, but in a nutshell, what we're doing is giving it a temporary capacity to heal, to stabilize, to control inflammation, etc.